It is a disease that kills more Americans than breast cancer and prostate cancer combined, and it is growing fast. More than 7 million people in the U.S. have Alzheimer's, and that number is expected to almost double by 2050. That's according to the Alzheimer Association. Alzheimer's disease is a condition that gradually damages and destroys nerve cells called neurons. Researchers believe these and other changes in the brain may result in symptoms of Alzheimer's, such as problems with memory and language. But a new blood test may be able to alert doctors to the disease 5 to 10 years before healthy people develop symptoms. Joining us now is retired Colonel Dr. Robert R. Redfield, former director of the Centers for Disease Control and Prevention. It's great to have you here with us. Now, Dr. Redfield, you've said that Alzheimer's disease should no longer be viewed as an untreatable diagnosis. Can you explain to our viewers what's changed in recent years?
Well, Veronica, actually, there's a lot of advancements that have happened in recent years. First and foremost, the FDA has approved actually a blood test that can give you high suspicion that you have Alzheimer's. Secondly, they've now recognized that there's really 3 stages to Alzheimer's: stage 1, stage 2, which are all preclinical, but still Alzheimer's. And then, of course, what people have referred to as Alzheimer's once you have clinical dementia and Alzheimer's. So I've been a big advocate of trying to get people to realize it's to their advantage to get diagnosed early before they have clinical disease. And that's the advantage of that new blood test, that we can do that now. The other thing that's important is there now are several FDA-approved treatments for Alzheimer's. There's also good clinical data that some non-pharmaceutical behavioral changes in your life changes the acceleration rate for Alzheimer's. So Alzheimer's is really an addressable disease.
For people who are watching, should they wait for signs and symptoms to then go and get the blood test, or should they try to be more proactive in some way?
Yeah, I think they should be much more proactive. I've recommended both to Secretary Kennedy and to Oz at CMS that I think all Americans over the age of 50 should have the blood test to see if they have preclinical Alzheimer's. And I think they should make a very standardized tool that they put in for the annual physical exam that they do with CMS for those of us over 50 that begin to assess our mental function. We do everything to assess whether our heart's working and if our lungs are working, if our kidneys are working. We need to do the same thing in terms of Alzheimer's.
What is it about Alzheimer that makes you want to share so much information?
You know, I think I got more engaged in it. After I left CDC, I went back to practicing clinical medicine. And the medicine that I practice now is largely taking care of patients with long COVID or a COVID vaccine injury. And one of the hallmarks in those patients is they have significant cognitive dysfunction. And I started to understand the impact that this cognitive dysfunction from long COVID, which fortunately is largely a reversible illness that gets better in 3 to 7 years, but how that distinguishes. Occasionally I find that the patients not only have long COVID, but lo and behold, when I work them up, I find out they also have Alzheimer's. And it just frustrates me when I see advances in medicine not get applied. Right? Alzheimer's is a very difficult disease. It's a huge economic burden in the United States, not only for the patients, but also for the caregivers. If I happen to be Catholic, I believe, that, we just have to deal with what we have to deal with. And we help patients have the courage to confront the illnesses that they have, and then help them try to address those as effectively as they can.
Absolutely. Retired Colonel Dr. Robert R. Redfield, thank you so much.
Yeah, thanks for having me. God bless.